This is another very interesting thing, because within the neuritis network, with this a huge German network which focuses on research in immune-mediated neuropathies, with several university hospitals included, we checked how everybody's managing their CIDP patients, and we found that the dosing patterns, the treatment sequences varied considerably, and sometimes also differed from the guideline recommendations. So within this network, we wanted to respectively assess the dosing patterns and also how patients with CIDP are generally treated. And among 9 centers, more than 600 patients were looked at. And here we found that in the first line, almost half of the patients were initiated with IVIg, so to say, intravenous immunoglobulins. The other half was initiated on glucocorticoids, with the vast majority being initiated on intravenous glucocorticoids, namely intravenous methylprednisolone. Only a very small proportion of patients actually followed the recommendations of the oral dexamethasone scheme. That was quite interesting. Last 8 patients within this survey were initiated on oral immunosuppressant agents such as azathioprine, and they continued over the whole disease course on this medication. In the second line, we found that most patients initiated on IVIg also stayed on IVIg. A small proportion of the patient was switched to subcutaneous IG. From the patients initiated on glucocorticoids, the vast majority changed to IVIg, irrespective either they were initiated on intravenous or oral glucocorticoids. And the last therapeutic line, the third line, at data cutoff, we found that almost 2/3 of the patients were treated with IVIg, and equally small proportions of patients on intravenous glucocorticoids and subcutaneous IG. Only 16 patients within this whole multicentric cohort were treated with oral glucocorticoids at the end of the survey. What is also very interesting is that 20% of the patients needed additional second-line immunosuppressants, such as azathioprine, MTX, MMF, and cyclosporin. Another 20% also needed escalation therapies, for example rituximab, bortezomib, cyclophosphamide. And lastly, of the patients treated with IVIg, 20% were on dosages exceeding largely the recommended dosage of 1 gram per kilogram body weight per 4 weeks, reaching up to 2.5 gram per kilogram body weight. So in conclusion, what we found here in this survey is that the patients with CIDP are not only treated very differently between the different centers, but also differed largely from what is recommended in the guidelines.